Welcome to Strike Stroke. My name is Dr. Mekdas. Today I would like to talk to you about heart disease and how that is a risk factor for stroke. 4 common heart diseases that are risk for stroke include 1. Heart attack, 2. Global heart weakness, 3. Valvular heart disease, 4. Arrhythmia. So we'll go through each of them so we can understand them better. Heart attack is a risk factor for stroke. Heart attack and stroke, also known as brain attack in different parts of the world, have many things in common. 1, they're both disease of the blood vessel, and 2, they share the same risk factors such as hypertension, diabetes, high cholesterol, smoking, and excessive alcohol intake. So if you were told you have heart disease and you control these factors really tightly, then your chance of having a stroke will be reduced. How does having a heart attack become a risk factor for stroke? When we're talking about heart attack, we're focused at the left portion of the heart, which is the left ventricle, most importantly. So when an individual suffers a heart attack involving the left ventricle, the portion of the heart that was damaged or will be weak and will not pump adequately as the rest of the muscle that is not damaged. So when this happens in the weak portion of the heart, blood stays a little bit longer than it should. It leads to clot formation in that region, and when the heart does pump, that clot can travel to the brain and cause an ischemic stroke. A second scenario is dilated cardiomyopathy. In this scenario, the entire heart is dilated, it's not pumping adequately. If the individual is compensating well, they might not have a stroke, but under certain circumstances where the individual becomes critically ill, or there is an increase in systemic demand and the heart is not able to meet this increased systemic demand, the individual can suffer global ischemia involving the entire brain. Another scenario in globally weak heart is that clot can form in the left ventricle, and this clot can dislodge, travel to the brain, and cause an ischemic stroke. Scenarios that causes a global weak heart can include ischemic heart disease that slowly progress over the years, or it can occur due to toxin ingestion such as cocaine use or excessive amount of alcohol. Another scenario can be congenital, where an individual has an infiltrative disease process called amyloidosis. The third scenario where heart disease can become a risk factor for stroke is if an individual has valvular heart disease. In this case, our interest always remains on the left portion of the heart. So we're looking at the mitral valve, we're looking at the aortic valve, because these are the valves that are involved in the left portion of the heart, which feeds the systemic circulation, including the brain and the body. So if an individual has vegetation on the valve, either due to infective endocarditis or non-infective endocarditis in a setting of autoimmune disease, or if they have mechanical heart valve, which is thrombogenic and has clot formation on there, all of these vegetation from the valve could move into the systemic circulation, go to the brain, and cause an ischemic stroke. The fourth scenario where heart disease can become risk factor for stroke is if an individual has what is called atrial fibrillation. And our interest is again on the left portion of the heart, and we're looking at the left atrium because the top chambers in atrial fibrillation are quivering and they're not pumping adequately. And we know if the heart is not pumping adequately, blood tends to stay stagnant longer than it should. And in this time, clot can form, and this clot can move from the left atrium into the left ventricle and go into the systemic circulation, feeding the brain, and cause an ischemic stroke. Thank you for watching. I hope you found this information useful. And always remember to dial 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke, so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.